Cassandra Alexander, Year of the Nurse, a 2020 COVID-19 Pandemic Memoir. Prepare to immerse yourself in the gripping memoir of a frontline ICU nurse, Cassandra Alexander, in the battle against COVID-19 during the year 2020. Witness the harsh realities of managing scarce protective gear, the taxing experience of nursing intubated and paralyzed patients, the controversial mask-wearing debate, and the toll the pandemic has taken on mental health, especially among healthcare workers. Combining a range of themes, from the struggles with family who ignore scientific facts to the systematic inequality, this engaging summary will leave you with a deepened understanding of the challenges faced by those on the front lines of this ongoing crisis.
ICU nurse discovers proning to be remedy for COVID patients. Cassandra Alexander, an ICU nurse, discovered the technique of proning COVID patients while watching a video of Italian nurses. Placing patients on their stomachs allows access to a greater lung surface area to aid breathing. Proning an intubated patient is dangerous, but it is done when necessary. Patients require constant checking and can become vulnerable to sores unless attended to regularly. Nurses battling COVID-19. When COVID-19 first hit, hospitals across the U.S. underestimated the severity of the situation. In a major New York hospital, close to 1 million masks were required in a week. Acute shortages soon followed, with many hospitals even recommending nurses use bandanas or scarves as an alternative to masks. By March 18, 2020, the mask crisis had worsened with the CDC's suggestion to ration masks. This led to nurses having to reuse their isolation gear and source their PPE themselves. Many were forced to rely on rationing and donations from others to protect themselves. The vital role of ventilators in COVID treatment. Lungs are vital organs that transfer oxygen into the blood. In COVID cases where the lungs are damaged, a breathing tube connected to a ventilator is inserted. Ventilators control the volume and percentage of oxygen, breaths taken, and force of oxygen inhaled. In severe cases, nurses may paralyze and prone patients, allowing the ventilator to take over completely. The settings are tailored to each patient, and the procedure requires sedation. Although daunting, ventilators play a crucial role in the recovery of COVID patients with damaged lungs. The controversial mask-wearing debate. Despite White House guidance, many states started reopening without mask mandates when cases were not declining. The lack of restrictions caused people to gather without masks, leading to an increase in COVID cases. However, a hair salon with 2 COVID-positive hairdressers who wore masks did not pass the virus on to their clients. In contrast, a family gathering for Thanksgiving led to multiple hospitalizations and 1 death. The debate continues, with some advocating for masks as a preventive measure and others opposing them. COVID-19 and economic trade-offs. A 2020 article by the American Association for the Advancement of Science predicted that COVID-19 would persist into 2022 without a vaccine. The article argued that the most effective way to control the pandemic was to provide people with enough money to stay home. However, some states reopened because lockdowns were perceived as harmful to the economy. Reopening Disney World and schools created dangerous situations for workers and teachers. By contrast, South Korea shut everything down when cases rose above 50. The article concludes that the U.S. needs to prioritize public health and support people financially to curb the pandemic. Struggling with COVID denial. Despite her efforts to educate her Trump-supporting family on COVID, Julia Alexander still saw her mother fall ill with the virus. Alexander's parents and brother preferred to believe the Trump administration over scientific facts, leading them to ignore Alexander's warnings. As a dedicated healthcare professional, she found it frustrating that some people's reckless attitudes were prolonging the pandemic. Alexander was particularly incensed with religious leaders who opposed lockdowns and encouraged in-person church services. For Alexander, this mentality let individuals avoid taking responsibility for their actions. Despite her mother's COVID-19 infection, Alexander remains hopeful that her family can come around to acknowledging the science behind the virus. The grim reality of a COVID winter. The Trump administration failed to provide any guidelines for Thanksgiving amid fears of a COVID-19 surge during the holidays. Nurses are working longer hours as hospitals struggle to cope with a dwindling workforce. The number of COVID patients keeps increasing, with healthcare systems running at full capacity. As of mid-January 2021, more Americans have died from COVID than in World War II. COVID-19 and racism. COVID-19 has hit Black and Indigenous people harder than their white counterparts. Furthermore, the people who downplay the virus and refuse to wear masks are often white and wealthy. This racism extends to employment situations, as seen when a Black doctor lost his job for speaking out about ICU bed shortages. These incidents illustrate the need for white people to take responsibility and speak up for non-white people. While it is unfortunate that white people tend to listen to other white people instead of people of color, it is crucial to dismantle these biases and actively fight against them. For instance, not wearing a mask during a pandemic is a form of racist aggression, and all people, regardless of race or social status, should take precautions and protective measures seriously. COVID ICU staffing crisis. Hospitals faced ICU staffing crises due to COVID-19 patients requiring highly complex care that involves trained ICU nurses. As the COVID-19 pandemic surged in November and December 2020, hospitals struggled to keep up with the influx of patients. Many people suggested bringing in the U.S. Navy hospital boats or building tents to house more patients, but author Alexander argues that the problem was not the availability of beds but the availability of staff. COVID-19 patients require highly skilled care from trained ICU nurses, and as hospitals reached capacity, there were no spare nurses to go around. Some hospitals offered travel nurses up to $8,000 a week, but even that was not enough to alleviate the staffing crisis. COVID-19 patients tend to occupy ICU beds much longer than non-COVID patients, and caring for them is highly complex. California had a ratio of 1 ICU nurse to a maximum of 2 patients in December 2020 to ensure a high level of personal care. Training to be an ICU nurse takes years, and even experienced nurses need training on the specific institution's processes and workflows. Furthermore, many nurses quit as they struggled to balance their caregiving responsibilities for relatives with COVID-19 and their job commitments. In conclusion, the COVID-19 ICU staffing crisis was a result of the high level of specialized care that COVID-19 patients require, which involves trained ICU nurses who were in short supply. The toll of COVID on healthcare workers. The mental well-being of healthcare workers has been affected by the ongoing COVID pandemic. Burnout and PTSD are widespread among healthcare workers. A healthcare worker recounts her struggle to find mental health support before eventually being granted unpaid leave through FMLA. Healthcare workers require better recognition and support from society and the government to help them continue their service. Additionally, healthcare workers need salaries that reflect the risks they take every day, protection from anti-vaxxers and those who believe that COVID is a hoax, and assurances from hospital authorities that they are committed to protecting their staff.
As we conclude our journey through this captivating and insightful summary, we are left with a vivid image of the sacrifices made by healthcare heroes like Cassandra Alexander amid the global pandemic. We have explored the intricacies of managing PPE shortages, the demanding and specialized work of ICU nurses, the cultural and racial implications of non-compliance with protocols, and the impact of the situation on mental health. This memoir leaves us with a profound appreciation and empathy for the healthcare workers who fought tirelessly for the lives of their patients, and a heightened understanding of the personal and societal consequences of the pandemic.